Hello, my name's Jill Tree and I'm the owner and founder of Essentials for Health, a school of massage in the UK, which I started way back in 1992. We're currently celebrating our 21st year and I have decided that this is the year where we really step up and start to make an even bigger difference to the UK society through the healing power of touch. I've written a manifesto for the Pro Touch Society, and in it I have a number of points that I want to cover with you to get you to see where I think we should be in the UK. And I think we have come a long way in that time. I've certainly seen many changes since my start in massage in the late 80s. We're called massage therapists now. We are really recognised as a profession. We have professional associations looking after our interests. We're employed often by the National Health Service in Marsden hospitals, for example, the cancer hospitals. There's on-site massage, where massage therapists go in and give chair-seated acupressure massage in the workplace, often funded by the employer because of the benefits of massage. But I still think we have a long way to go to get to a society that I will feel happy and proud to say is a pro-touch society. So what are those changes that I'm looking for? I think the first one is really looking at how the National Health Service can embrace and incorporate massage much more effectively into healthcare provision in the UK. Now that could be GPs making referrals to massage therapists and indeed even writing prescriptions for massage. Wouldn't that be fantastic and amazing? But there are gaps in effectiveness. There has been identified by GPs certain diseases and disorders where they really are not able to help their patients anymore and they're looking for alternatives. And massage can be effective for those particularly chronic conditions, things like anxiety and depression, musculoskeletal disorders, skin complaints, arthritis, anything to do with pain, where people have a lot of chronic pain. Massage has a huge role to play in helping patients manage their conditions, lead a healthier and more normal life, have a better quality of life, and possibly even return to work if they're able to manage their conditions in such a way. I'd also love to see nurses, busy nurses, be able to give some massage. I've worked in hospitals as a massage therapist and I just see the hustle and bustle of the nurse not able these days to interact adequately and in a caring way with their patients. I think massage, just gentle hand massage every now and then with a patient would actually help a nurse put their care back into nursing. I'd like to build a statistical awareness of the contribution that massage therapists are making to the UK society. Massage therapists, by their very nature, are very giving and very caring. That's why they work in massage in the first place. And they often work as volunteers in places like hospices to help patients there have a better quality of life. Wouldn't it be great if we could actually evaluate how much that is worth to our society? For most of us, it's very instinctive and natural to reach out and touch. And I'm getting very concerned that we are beginning in the UK to start to legislate against that human nature. People like foster carers, social workers are becoming inhibited around touching the people that they're caring for. Nurses and doctors probably feel the same. I know in my son's school, my son's 5, teachers often don't feel able to give him a cuddle when he falls over and hurts himself. It's time we look at that and look at how we can give permission to touch and to follow our human instinct around caring and nurturing the people around us in society while still doing that safely. And that takes me to my 5th point, which is about educating people that appropriate touch when given early will help prevent inappropriate touch. Back in the 1990s, I introduced a program to the UK called the Infant Massage Instructor Certificate, and it was there to train people to learn how to teach baby massage to new parents. And it's found that if babies are given regular, appropriate, loving touch and possibly massage, they learn to give indications to their caregiver or their mother or father when they don't want touch, and they learn to say no to things that are inappropriate to them. If we are able to educate our youngsters at a very, very early age that it is completely appropriate to say no to touch, then it may be that we can start to prevent some of the sexual and physical abuse that seems to be on the increase in the UK society. I also introduced in 2000 a programme from Sweden called Massage in Schools, and there children aged between about 5 and 8 are taught very simple little games, maybe drawing weather maps on each other's backs or pizzas over clothes, for them to learn appropriate touch with each other. Now, research in Sweden has shown that there's less bullying in the classroom, there's less fighting in the playground, concentration is improved just by this very, very simple programme. I want to see that programme and similar programmes coming into the UK and becoming much more mainstream and accepted in our institutions. Finally, I'd like to see massage available for all who would benefit from it. So for those who are unable to pay for it, maybe there's some sort of scheme that we can introduce as massage therapists where we offer a little bit of voluntary time to give to people who would really benefit, where massage is highly indicated. It might be the most vulnerable in society, those who are suffering acute depression, those who are suffering from Alzheimer's disease, people who are suffering from a serious illness like cancer. That's my hope, to make sure that massage is incorporated into mainstream provision in the UK to make the UK a more pro-touch society.